Welcome to the Module 4 Lecture Part 2, Assessment of Senior Fitness. This is Dr. Ruby. Now we will discuss laboratory-based physiological assessment. These assessments follow and test general health-related and motor skill fitness components. Things like CRF, muscle strength, body composition, balance. So cardiorespiratory function is one of the main things that we measure and is thought to be the most predictive of overall fitness level and functional ability in older adults. So this is the one component that we'll see tested most often. These tests are performed by trained professionals. They provide an accurate assessment of health-related fitness for the older adult. And the results of these tests can provide safe and effective exercise intensities, such as target heart rates and resistance scales, for types of activities and exercise settings. Cardiorespiratory function, or CRF, is defined as the overall function of the cardiovascular and respiratory systems. It's also referred to as aerobic fitness, or aerobic endurance, and sometimes even cardiorespiratory endurance. There are two main reasons for testing cardiorespiratory function. One, it is a key determinant of maintaining independent living, carrying out regular activity to support activities of daily living. And second, establishing cardiorespiratory fitness establishes a baseline before starting an exercise program, so we can use it as a comparison over time or a result of interventions that we are performing with a client. There are several testing methods for cardiorespiratory fitness. We classify them as both direct methods and indirect methods. So direct methods are measurements during maximal intensity exercise tests, and indirect methods are measurements during submaximal exercise intensities that can be extrapolated or predict what scores will be during maximal work. At times, clients are unable to work at maximal intensity, so we need to use an indirect method. Although direct method testing is more accurate, it involves rigorous exertion and specialized expensive equipment, and typically it is not done with older adults due to risks. Indirect testing is easier and can be done with those where more caution is needed, and they are more often used in the older adult. Here in this photo we can see the cycle ergometer test. It can be done direct or indirect, and VO2 max is being measured and assessed in real time in this photo. There are several conditions and variables for testing cardiorespiratory fitness. One is that we need to standardize test conditions and verbal instructions. So every client that gets tested in the same way to allow for reproducibility of the testing and to increase the overall validity of the test results. We need to adopt a professional approach. For example, provide a full explanation of the procedure and allow time for questions from the client. We need to be clear and steady in the use of time, allow clients to be familiar with the equipment, and this will help to reduce their anxiety and get more accurate results. We need to standardize all of the following: temperature, time of day, psychological environment, seat height on the cycle ergometer, and the type of treadmill or ergometer that we're using. There are three common measurements taken during cardiorespiratory testing. These would be considered our dependent variables. One is the rating of perceived exertion. That's the RPE. Two is the heart rate at rest and then at working, so the beats per minute measured at the wrist. And lastly, the blood pressure. VO2, or volume of oxygen uptake, used during exercise, and VO2 max, maximal volume of oxygen possible to uptake for an individual can also be predicted and are usually reported in results using clients' heart rate measures. There are some recommended tests for cardiorespiratory fitness in older adults. One is the treadmill test, and two is the cycle test. We have under the treadmill test, the modified bulk WAR treadmill test. You can see this in table 7.1 for the full procedure. Here are some descriptions of the test. This test can calculate oxygen consumption by using heart rate, age, and weight at rest to determine heart rate max. An example cycle ergometer test is the Ostron rhyming test, and this test uses a leg and arm cycle ergometer. You can see table 7.2 in your text for the full procedure of the leg ergometer test and table 7.3 for the arm ergometer test. Here are some instructions for the test. This test can predict VO2 max or compare heart rate and VO2 at a given work rate from a test-to-test environment. Another physical measure would be muscular strength. This can be measured by isometric or dynamic testing. It can be used with older adults, and we may find that older adults may exhibit higher eccentric controlling strength than concentric or isometric strength. Free weights, pressure, and or pulley systems can be used to record the amount of resistance moved or the pressure or foot-pounds that were produced. The speed of movement can also be assessed for dynamic strength testing. We should note that in testing muscle strength, we are looking at the highest amount of weight a person can move as opposed to muscle endurance, where we would be looking at multiple repetitions of movement with the lower resistance. The most common muscle strength test used is a 1 repetition maximum. This uses free weights or pulley or pressure machines. There are two main 1 rep maximum tests, the chest press and the leg press. It is important that we standardize all testing procedures when performing a muscular strength test. We need to use the same equipment, the same setup, and the same repeated comparison for pre- and post-test results. Isokinetic testing can also be done for precise constant velocity measures, although it is very expensive and requires specialized equipment. Body composition is another physical test. In a body composition test, we measure the percent of body fat. The most accurate tests require specialized equipment and a laboratory setting. These tests include hydrostatic weighing, or the BOD-POD, or bioelectric impedance analysis, called BIA, and finally imaging through DEXA and MRI scanners. Balance testing is another physical measure. Balance is the ability to control the body's center of mass relative to the base of support, whether that base is stationary or moving. There are 4 recommended measures of balance for older adults, and these tests will all be covered in Module 6. We have static balance, dynamic balance, reactive postural control, and sensory integration and organization. Static balance measures postural sway in a stabilometer or static force plate. The eyes are open and closed, and then the older adult reports a greater postural sway than the younger adult. In dynamic balance, we measure the movement of the center of mass through limits of stability which exceed the body's center of mass. For reactive postural control, we use computerized dynamic posturography with a platform that tilts in all directions and measures the ability to regain the loss of balance. Sensory integration and organization uses the same computerized dynamic posturography testing, but in a variety of situations, varying the sensory input, including eyes open and closed, touching and not touching support, and or moving visual surrounds. You can watch some of these at the YouTube link below. This concludes our discussion and lecture for Module 4. Please proceed to the quiz.